What We Are Resilient is doing is giving those caregivers, from intake staff to screeners to pediatric providers, doctors, nurses, etc., a way to interact with themselves in a resilient way, because there's so much burnout and difficulty in working in that profession.
One of the things that healthcare providers don't know is that they are enough. They are enough. Their presence can be enough to change someone's life. It's a huge impact how they are with the family.
Like any really high-powered, high-pressured workplace, difficulty in relationships in the teams, relationships between people, interactions. How We Are Resilient helps with that is attending to the adult care providers and their own adverse childhood experiences. Adverse childhood experiences are experiences that a child has had that has created some adversity in their life. It could be the trauma of parents separating and leaving, the trauma of emotional abuse, the trauma of sexual abuse, the whole spectrum of trauma. And what happens in a child's life is when they've experienced trauma, there's a direct correlation between the number and severity of the trauma and their lifelong health. And if we're blind to those impacts, then they can be re-triggered, which we call vicarious trauma. A staff member might be interacting with a patient. The patient describes an experience that the caregiver actually had themselves, and it could cause that caregiver to close down, take distance, not be fully attentive. And it's the relationship, the being present as a human being to another human being in their suffering, that allows them to accept themselves more fully. Of course, the relationship with self, when it gets opened up and gets balanced, creates a different caregiver-client relationship.
We Are Resilient takes those ideas that medical providers are a really important point person for families and can give them good information. If they learn that a family has adverse childhood experiences and teach the families about the resilience that they can have, give them coaching and specific resilient skills, healthcare providers can give that to families.
So it's a full wraparound model that can be used in any segment of life at the clinic, which is people in their own lives, with themselves, with their teammates, colleagues, patients, their own families.
When I look at the world and I look at where the pain is in the world, I know that if people have a better sense of how they can calm themselves, center themselves, how they can connect with each other, and how they can collaborate together, that we can solve the problems that the world has.